going to get sound. How do we know? We got sound now. We got sound now. So Megan, we should start over. That we missed this. Megan's with WRNI, Public Access.
Rhode Island Public Radio.
Rhode Island Public Radio, right? Megan Hull is also a blogger and a writer and a reporter, right? And her focus of effort is really healthcare. And we found you, as we were talking about, very serendipitously about, 3 or 4 weeks ago.
Right. So I report on the air, but I also have a blog called The Pulse, where I write about healthcare. And some days I'm not sure what I'm going to write about. So I follow other people's blogs. And Paul Levy, who used to be the president and CEO of Beth Israel Deaconess Medical Center, was writing on his blog about all of his experience with lean. And he was announcing to everyone that he had a whole other website just devoted to the lean concepts and how they worked at this hospital. And I decided, I'll link to that and I'll write up a little bit about it. And I mentioned that my mother actually works on lean at a hospital in Oregon where I grew up. So I thought I should figure out what my mom's up to, and wrote a little post about it. And a man named Mark Grebin, who is a lean expert, somehow found my blog and said, oh yeah, lean's really interesting. I asked him who was doing lean in Rhode Island, and he led me to you guys.
Yeah, and Mark has really started devoting a lot of his career. I'm sure that you're an avid reader of Mark's stuff, because it's kind of very tactical, very profound in the sense that you can use it. You can use it. And so many times, and I'm sure that when you grew up with your mom, has she been a healthcare provider her whole life?
She's not a provider. She actually does sort of management work, so organizational development and things like that. So she was hired by this hospital in Salem to help them implement lean. Right.
And probably early on in her career, she had those moments where she came back from work saying, you know what, this just isn't quite working right. Does anybody really understand the scope? And at the end of the day, what we're trying to do is, make more time for caring, like I talked about in the lecture with the lifespan people, and also fix things that are broken, because so many things are legacy things, and they're just broken. And so Megan came, we saw her talk to Mark, and then we invited you to a lifespan thing. And the people at Lifespan were great. They said, come on in.
Yeah, it was great. Because I'm a healthcare reporter, my stories have to be about healthcare things. But I thought this would make an interesting radio piece where I could go to this factory, talk about a concept that's been used here, and then talk to the people at Lifespan and say, how did these ideas translate into the hospital? And Timothy Babineau, Dr. Timothy Babineau, who's the president and CEO of Rhode Island Hospital, said that he sort of had an awakening coming to this factory, and it convinced a lot of his senior management to try this idea. So I'm interested in how looking at something that has, on the surface nothing to do with what hospitals do, created a connection for these folks in that industry.
Well, if you really, and you did a Gemba walk here. Gemba means going to where the work is done. You did Gemba walk. And the beauty about doing a Gemba walk is that we all have processes. And it doesn't matter, we could have dressed all the things up that we're doing as people in gowns and on gurneys and waiting areas and things like that, but we're working on products. So if you can at least get your brain around saying, okay, they have processes they need to get from point A to point B, and we have to go through certain processes. How do we do that in an efficient, effective manner and don't end up a lot of waiting, a lot of rework, a lot of excess inventory, all these things. So, I really applaud Tim and his team, because they're willing to step out and say, you know what, we're struggling with how to do things different, have a paradigm shift. How do we get people's heads around it?
And I think it's hard for the healthcare industry, as well as it probably is for the manufacturing industry, to try something like this, because there's always a new consultant or a new book or a new theory. And I see it myself as a healthcare reporter. Everyone's trying to reinvent the system and fix it. So, when do you know something's going to work, and when do you know it's just the latest fad?
Yeah. Well, this is where, we talked about the pyramid, if you remember my pyramid, about the person at the top really listening to everybody underneath and being a steamroller, breaking the log jams, helping them with the depth and breadth and knowledge that they have of somebody being able to say, you know what, I keep hitting a roadblock here all the time. I need your help to get me through this so we can get better. And the culture developing, and I think that you saw the people at Rhode Island Hospital and Lifespan really have a culture there. And it was developing that culture. They have a very old, rich culture because of the way, I don't know how much you know about the way the hospital was founded and the legacy. They've written some great books on Rhode Island Hospital, how it was founded. So how do you take that culture and say, okay, we have a deep culture, now let's take it to be a culture of a change culture.
Right. And talk about the culture, but maybe get rid of some traditions that aren't working so well.
Yeah. And that's the hard thing for people to do.
How do you do that? How do you say, okay, we know we have this tradition, we want to honor it, but sometimes we shouldn't do things just because they've always been done that way.
Yeah. So how long have you been reporting on healthcare? Let me just kind of set the stage here for everybody.
Yeah, I've been the healthcare reporter at Rhode Island Public Radio for a little over 4 years.
Wow.
So I'm starting to actually know what I'm talking about.
Yeah.
And it's fun to be in a job where you put in the hard work and you start to understand who to call when you have a question and sort of a little bit how the system works. I'm still learning a lot because it's such a complicated system, and with healthcare reform there's a lot of change coming, but the blog has been a nice way to talk about all the things I know that I can't fit in a 4-minute radio piece. So the blog has been around for about a year and a half.
And what's the blog so people...
It's called The Pulse.
Do you have that, Ed, up on the screen?
I'll get
Ed's going to put that on the screen.
And I actually wrote a post about coming here today, so that's what you'll see on the front.
Yeah, Carl's picture.
Yep, and the show. So it's called The Pulse. You can find it just by going to the Rhode Island Public Radio website, ripr.org. And on the right-hand column, you'll see all of our blogs. So you just click on that. Or you can just Google The Pulse, Megan Hall. You should be able to find it.
And you know, how did you fall into, you've been there for 4 years doing this.
Yes.
So what did they feel the need or the void was to get somebody on board that was going to become their resident expert to report out to the general population?
On healthcare?
On healthcare.
Well, the reason the station was able to hire me was because they received 2 grants from the Rhode Island Foundation.
Okay.
They told the Rhode Island Foundation, look, we need more reporters. At the time, we only had 1 reporter, and that's definitely not enough to cover this state. So they said, we need more reporters, and the Rhode Island Public Radio, Rhode Island Foundation said, okay, pick the 2 issues that you think are most important, that we need to educate Rhode Islanders about. And they said education and healthcare. And that's also a priority for the Rhode Island Foundation, just in general in terms of their funding. So I'm not sure if it was us saying that or them saying that. I'm not sure how that flow of information happened because it was before I was hired. But so they had these 2 positions, education and healthcare. And I'd been an intern for the station, and I'd also been a freelancer for them. So they were familiar with my work. They knew that I could make radio. I didn't know anything about healthcare, but they said, she'll learn.
Yeah, and think about Dr. Babineau and his team and the people that I spoke to. They really don't know much about the lean tools and this operational excellence and process improvement, but they're willing to say, I don't know all the answers, but let me get curious. Let me learn. Let me ask the right questions. Let me have some mutual discovery, and we talked about mutual learning before. So it's probably taken you to some unique things. And Rhode Island, you know, I listen to a lot of Rhode Island talk radio.
Yeah, right.
Just from being on the radio. But Rhode Island, and I don't know if you even heard this, is that our heart attack rate is lower. And a bunch of other profound things from not having public smoking.
The public smoking. Yeah, that was a story just yesterday.
That was a huge, I thought that was a huge story.
Yeah, that was a story just yesterday.
So this is about, you know, lean is about PDCA.
What does that mean?
The circle, the scientific method. Plan, do, check, and it's either act or adjust. And it goes in a circle like so. So Rhode Island had done some planning and thought, you know, we're going to implement this
ban, the smoking ban.
And this could have been an initiative in lean that, you know, the Rhode Island Hospital is going to do a new initiative for intake. And then they do it. But while they're doing it, they're checking it, and they're making small articulations instead of big swings, right, as they're checking it. And then finally they do some adjustment, and in that adjustment there's a new plan. So what happens is you have this big loop, that you go into the scientific theory, and it gets smaller and smaller and smaller till you finally reach target condition. You know? So that's a critical thing, and to have Rhode Island as a state, and we are such a small state, you know that we'd be the perfect place for all these experiments.
Yeah.
It's a million people, and it's so small you can get direct correlation to things.
That is the tempting thing about Rhode Island. I think that's what's so alluring about this place and why people want to stay here. They come here, they think, I could get my arms around this place.
Right.
I can make something happen.
Yeah. So you did a Gemba walk here. And this is probably the first time you've been to a manufacturing place.
I can't remember being to one
Especially
before.
a vibrator manufacturing place.
First vibrator
You gotta
factory
spice
for
that
sure.
up for your listeners if
Yes.
they see us. So what did you think? What were some of the impressions?
I think the first, I talked to Ed, who's running the camera right now, and what struck me was that I know Ed from Brown University, where I was a student.
Oh, you do?
And he ran the multimedia lab.
Oh, Ed.
So
Now we can confirm that he was actually there.
I saw him.
Always suspect.
So that was interesting that someone who had an academic job decided to work for this factory that makes vibrators. So there must be something going on here that's interesting enough.
Especially a talented guy like Ed. He's very talented.
Interesting enough to convince him to give up that position, which I'd imagine was pretty good. I know Brown has good benefits, and it's a prestigious university, so that piqued my interest.
But can he say that he's a photojournalist for a vibrator company?
Now he can.
Always an icebreaker.
Now he can. So that was interesting to me. And then I met, I'm not remembering her name, but she works with Al. They're Andrea.
Yep.
And they were showing me their cards, and the cards talked about their different skills and what their strengths were. And
Marcus Buckingham.
She was telling me about the test that they took.
Right.
And I'm familiar with those concepts because of my mother and her experience with management and trainings. She does the Myers-Briggs test with people, which is a similar idea. Figure out how people problem solve and process information so then they can...
Thinking preferences, things like
that. So they can solve problems in a way that works for them. So what was interesting to me was that they'd taken that test, and I understood how that worked, but that she was in IT, and she actually was originally in accounting. And someone just said, you have the skills where you would work really well in this other department, and you really complement Al's abilities, so why don't you just try this whole new job? Yeah. So that was something that was interesting to me, that you decided to say, we value you, but we actually think you'd be better at this whole other thing we didn't even hire you for.
Yeah, and she does a great job there. And she maximizes, this is one of the things that all organizations, and your mom's probably in tune to it and you've seen it, is that if you want people to be really happy and self-actualize, get them to do things that they're really good at and can feel some great accomplishment with. So many times people fall into that position or that job or activity that they do, and it really doesn't self-actualize them, and they get really bummed out, and they get crotchety, and they get cranky, and you wonder why they're that way. Take a look at it and let people have the opportunity to change, their circle of influence, the things that are around them that they can change, and pretty rapidly too. So you saw Al, you saw Andrea, you saw Ed, right? And then you went out to the factory.
Yeah, we went out to the factory and talked to a few people about how they've changed their workflow to fit their needs and invented ideas for themselves to make work interesting or more effective. And I talked to one man who's in charge of shipping. Clark. Yep. I talked to Clark, and he said he'd worked here for 18 years. And that for a while the culture was just really depressing and he didn't want to come to work. But that the biggest change, besides just letting people make their own decisions about how to change their workflow, and that sort of, I guess they're all related, but not just the actual changes in how they do things, but just the culture of how people feel about their work, he said was very different. And that people are happy to be here now and enjoy what they do, and before it was kind of depressing.
Yeah, and that is the sense of giving people some kind of purpose. Because whether we're a small organization or a big organization, what am I here for every day? You know, what is my mission to support, you know, the bigger global corporate mission, and ours is same day, next day. People want things today or tomorrow. They don't want to wait any longer. They don't want to hear excuses. They don't want to hear that you couldn't get X, Y, Z, and that all these things, because they have their own problems that they're dealing with. They want stability. They want reliability. So if we share that vision, that true north with everybody here, they all have a stake in that, in making it happen. And then in having that stake, they have to have the ability and the latitude to change their workflow, to change their areas, to have total ownership of what they're doing to support that, and also have the ability to ask a lot of questions and to raise their hand and say, this isn't working, I don't know how to fix it. And that's one of the bigger pieces in Lean, is to have the humility, or just have the ability to have a trusting organization, that when you put yourself out there and become vulnerable, because in a lot of organizations, and you can think back, when you say, I don't know and I need some help, then that's the potential for somebody who might be your boss, who might be a coworker,
to make fun of you.
Yeah, to make fun of you, or even to just say,
to
judge you, it's uncomfortable, or just to say, is this really the right person on my team? And probably more than likely, it really is the right person, because they're saying, I just don't know, I need some help at this, I'm really good at this stuff, show me, and I can get over that hump, and let's do this, and learn together. And that's a big thing.
Well, one question I had for Clark, which is probably a good question for you too, is, was it hard to let go of control? Because he says that now guys working below him make their own decisions about how they manage their work. Was that hard for you to? It's
still a hard thing to do, any leader, and it's trying to figure out how to make it comfortable both for the people receiving more responsibility and having the ability to do more things that they're in control of, and me passing that on, is figuring out strategic ways so it feels natural, you know, so it just happens, because the natural instinct is to get defensive, because, you know, you put a lot of work potentially into it, and, you know, you feel a little bit threatened by things like that, you know, sharing, and it is to become sharing, because they relieve so much of the stress and anxiety and things of making things happen. And each person has a different way that I have to relate to them, how I give them that piece, you know? Because natural instinct is to, you know, pull back a little bit and want to retain it. But it doesn't do you any good. Doesn't do you any good. And I'm still learning. I'm learning every day, and I'm getting, hopefully, a little bit better every single doggone day. But
that's what Linda was saying. We were taking a tour of the factory, and she said, we're taking all this stuff that was against that wall, and we're sorting it, and we're moving it, because we have to figure out our flow. And I said, oh, I kind of thought you would have figured out your flow already. You've been doing this for 8 years. And she said, no, not really.
Yeah. And even today, you know, just you make assumptions. I don't know, do we have our circle of assumptions in here? You saw it at the presentation. The circle of assumptions is that I assume a lot of things. And the best way to get assumptions out of your head is I start saying, bring me all the paperwork, give me those pieces there, Ed. You know, they give me a report like this, if everybody can see that on camera. You know, it's a trend line, and it's a bunch of things. And I look at this, and I've made certain assumptions by looking at this. And you see all these extra drawings and all these extra pieces of paper. Everybody can see them here on the screen. And then I went back to my books, you know, and looked at some things about how I wanted the problem presented. And then I wrote down upside down. I wrote down some mandates of target condition and things that are going on. And then we drew some more pictures, because I'm assuming that things are happening a certain way. And we drew some more pictures, and everybody's saying no, no, no. And then finally we got to this one, the target condition. So to lead and not go out and get all the input and ask the right questions. Oh my God, I don't know how people do it. I just don't know how they do it, because it's so dynamic and so fluid the way things change on a factory floor. It's not even funny. And the day that we did this, I had a moment from, if you remember, last week. It was last week, right?
Yep.
Yeah, last week. Mike Rother was on the show, and this was coaching kata. And kata, you know, is an Japanese for exercise. You practice, you practice, you practice, you practice. You keep getting better. We keep practicing at this and learning new things. And then all of a sudden we get to another level and we say, holy mackerel, we learned a lot of stuff. Okay, now let's just change. Let's completely wipe out the things that we're doing now and change and morph this into something. So he happened to give me the 5 questions. What's your target condition? What is the actual condition now? What obstacles are now preventing you from reaching the target condition? Which one are you addressing now, right? Because you can address a whole bunch.
Yeah.
And that's where people get lost. And then he says, turn over the card, okay? Reflect on the last step taken, because you don't actually know what the result of the step will be. What was your last step? What actually happened? What did you learn, right? So now we return back to this. What is your next step, next PDCA experiment, because we're calling them experiments, and what do you expect? Because we're not doing these things, this PDCA cycle, or even rearranging this shop. We're not doing it in a vacuum. We have certain expectations and outcomes, and we're measuring that along the way, because we don't want to go down a path that is just dead end or will take us somewhere where we don't want to go. And when can you go see what you have learned from taking that step? So we used Mike Rother's stuff, and I hope that the hospital and a lot of the other people that we touch do that stuff. Mm-hmm. So let me ask you one question, because I left after my speech.
I left too.
Oh, you left, so I can't even get the inside scoop of what was going on. I got a lot of great thank you letters.
Oh, that's good.
And, you know, they kind of were, couldn't you sense in the room that they were kind of at a moment where they really wanted to change their whole organization?
I think that all hospitals are feeling that right now.
Right.
One, because of healthcare reform, it's going to pressure them to be even more cost effective. Mm-hmm. 2, because there are hospitals in the state that are losing money. I mean, this is the first year in recorded history that when you combined the spending and the profits of all the hospitals in the state, that they were in the red. So it's a breaking point and a warning call.
Hospitals in the state of Rhode Island.
So maybe one hospital still made money this year, but if you added them all up together, the net was negative. And that's never happened before.
Wow.
So, and we have 2 hospitals in receivership. We have Landmark in Woonsocket that's in receivership, which is a form of bankruptcy. Westerly is in receivership, form of bankruptcy. Who's next? We don't know. So I think it's a time where all hospitals are asking themselves these questions. How can we survive? What is our mission? Mm-hmm. What do we need to do right? What should we stop doing? Because maybe it's not best that we do it in a hospital. Maybe it's wasting time and money, and it could be better done somewhere else.
Right.
Maybe we need to improve our relationship with primary care doctors. All those kinds of questions. People have been asking themselves these questions forever, but when you're up against this economy, you're up against healthcare reform, I really think they're on the edge and are being forced to really make hard decisions right now. So that might be why they feel ready to look to other people like you to think of some ideas and advice.
They need to, because the burning platform and the burning platform for people that didn't start a lean journey early on. We started 10 years ago. Mm-hmm. And thank God, knock on wood, whatever lightning bolt, really hit us or hit me to say we're gonna charge down this. You see all the books and all the thought leaders that we've had on the show and learning. Thank God, because to play catch up and to reinvent the 10 years of discovery that we had now in an economy where there's so many more pressures, it would be insurmountable, right, Ed?
It would be.
I just wouldn't even know where to start.
Yeah.
And then asking yourself, where do you add value? Because the hospitals and we as patients, as we go in there to have procedures or have different things done, and onlookers, we say to ourselves, what is all this, double stepping past?
Waste.
Waste.
And there was actually an instance of that earlier this week. So there was a federal investigation into Rhode Island Hospital. The FBI got involved. And over 5 years, they found that Rhode Island Hospital was having patients spend the night after a surgery where usually it was just outpatient. Usually the patient came in, had the surgery. It was surgery for brain tumors, using radiation to shrink brain tumors. Usually that takes about 3 to 5 hours. They were out, done.
Mm-hmm.
Rhode Island Hospital was charging Medicare and Medicaid, the federal government, to have them spend the night. And the federal government said, no, that is wasteful, and you're going to reimburse us for what you charged us over those 5 years. So the federal government is getting serious about efficiencies. And Rhode Island Hospital could say, it was just nice to keep them in there, but the federal government is not allowing for that sort of excess anymore.
Well, and this is the pot calling the kettle black scenario, because I heard the same report, and I have 4 young children, and I have aging in-laws and parents and things like this, and as you see these kind of things happen, you say to yourself, there has to be some part of humanity. Does one extra day seem in excess with all the other wastes that go on?
Mm-hmm.
And is this somewhere that you want to attack it? Were you actually at the Gemba? Were you in that room with that person that just there was no way you were going to discharge them?
Right.
And
exactly, and that's a problem when you have...
It's a big problem.
When you have, as you were saying, with this pyramid, when you have the federal government at the top making those decisions for the hospitals, then they're not on the ground floor. But the problem is, there are problems that exist. The federal government doesn't feel like hospitals are adequately addressing them, so they're swooping in. So hospitals like Rhode Island Hospital need to be aggressive and play offense and start solving these problems themselves.
Correct. And the platform for doing this is operational excellence, looking at these things and trying to really work through, how do we meet the demands of what everybody wants from us?
Mm-hmm.
And then you have this outside concern, this is a big group saying that this is the way that it's going to happen, and it's going to get more and more and more and more restrictive. And it hasn't even come down yet to us as consumers for health care about what these restrictions are going to look like. It's a scary thought. So if we're going to become restrictive on what we're doing, myself as a consumer, I want to go to somewhere where I know I'm going to get it done the right time, efficiently, effectively, and especially when it comes to health, that these guys are really on their game. They have a fine-tooth comb, and it's going to happen right. I can't go into a place that there's a lot of confusion, a lot of excess, disorganization, and all these kind of crazy things going on, because it's going to be bad.
Yeah.
It's going to be bad.
Yeah.
So.
But the problem is the way people are reimbursed right now is, maybe you're not getting paid enough for another procedure. You make a little extra by having someone spend the night. You're motivated in this really perverse way sometimes to waste.
I know. I'm going to grab some books while we're talking here.
Okay, go ahead.
Keep the camera going, because I don't know how many of the lean books that you've seen on healthcare, because I had a bunch of them that I brought. Where the heck are they? Let's see here. There's some great books. And hopefully you've been poking around, because these are the things that are going to unlock a lot of the tools that they need, because no one's been trained. When you went to Brown, they didn't train you in these kind of things, and your eyes are kind of opening up now a little bit to the neat thing. And this book is Work That Makes Sense.
Mm-hmm.
Simple, practical book from Gwen Galsworth, is it? Yeah, Gwen.
Mm-hmm.
Yeah. And if you look through the passages here of healthcare, Gwen spends a lot of time in hospitals on just marking out flow lanes and, the inventory levels of rubber gloves. You figure the population of lifespan, and we keep using that, but any hospital.
Right, South County, Care New England.
Yeah, or anybody in the country, that if you can cut out $10,000, $15,000 worth of excess rubber gloves and just have them when you need them, that goes to the bottom line. If you can cut out the amount of processing time of paperwork to intake a patient, where the national average is, say, $50 to get somebody into the hospital, and your hospital's operating at $150, you have a lot of waste in there, a lot of duplication.
I think what some people who are afraid of this concept might say, though, is, well, just in time might work for a factory, but we're talking about human beings. Like, what if we're so efficient we don't have that random thing that we might need because, people's health emergencies are unpredictable? What would you say to that sort of way of thinking?
And I'll guarantee you that now they don't have the right things at the right time. Guaranteed. And if they start looking and being more conscious about getting the right things and focusing on it, they'll have more of the right things in the future. Because they are no different than this doggone factory. None whatsoever, unless they've been on the lean journey for a really, really, really long time. We had way too much of one thing and not enough of another thing. Things were always late. Things were happening. People, just never mind the human resource issue of people being sick. Life happens.
Yeah.
And, availability, double scheduling a machine. Well, it's the same as double scheduling an operating room.
Mm-hmm.
That happens all doggone day at a hospital. So if people take their focus and their energy and say, okay, we're going to work in small incremental steps, because there's no big wand that goes into the hospital and says, we deem you operationally excellent, that everything's going to flow, you're going to have flow. No, we're going to look at this and we're going to say, what's our biggest pain right now? What's the biggest hurdle that we need to address to help support our customers and to support the vision of the hospital? Number one, lean is all about customers. If you think it's cost savings and all these other things that go about your merry way, saying we're going to drive down 2 million, 3 million, 100 million out of costs and we're going to use lean to do it, you're going to fail. You will fail. And we've seen it again and again and again. And you can ask Mark Graban and talk to any of the lean bloggers or any lean people that if you say this initiative is to save money and do all these things, not happening. It's for the customer. We're doing this to have more time to care for patients, because that's what they were doing in that initiative with the blood clots in the brain, right?
Mm-hmm.
That, well, we were being a little empathetic. We let them stay overnight and now bit them in the behindy.
Mm-hmm.
So if we say to everybody, okay, we're going to make more time to care for our patients, that's what our initiative is. And all the other things that get in the way are waste. Let's get rid of those things.
Mm-hmm.
That's the power of it. And you have, her book here, and the book here that I was going to bring.
Mm-hmm. And maybe if you're operating the way you're talking about for these patients that have the brain tumors or the blood clots,
right.
Maybe if you're thinking about it in your way, you say patient by patient, like, you know what, you would be happier going home, and it would be less stressful for you to be in the hospital, and you could send them home. Not saying, let's just have everyone stay over because we need the money.
Or, and we're not there. Neither one of us are there.
Right.
Or you say to that unit, okay, we can't do this. So that means that everybody that goes in for this procedure, let's try not to have any past 10 o'clock. Because once we go past 10 o'clock, then it gets really tough to, discharge them and this and that. Just figure out things.
Right.
Figure out the positive workarounds and get a standard work.
Exactly. You can be customer-centered
and
not necessarily make them spend the night because you think that's what they want.
Correct.
Because I'd imagine this is the case with your customers, too. They all need different things.
They all need different things. And then John Toussaint's book and Roger Gerard, right, On the Mend. And he's with DataCare. Hopefully you've been reading some of John's stuff because he's unbelievable. And, Pascal Dennis, it's called The Remedy, but it's not about healthcare. But what this book is about is bringing lean thinking out of the factory into the transformation of the total organization, where he's talking about that this is a prescription for anybody to take it, not only in the factory floor, back office, everywhere, and just do it. So, just some good stuff.
Great.
And how, any other final thoughts for everybody? We've been jabbing here for a while, and I'm going to start reading your blog and see what you're coming up with.
Good. Well, I'm going to be I'll have a radio feature about this connection between lean in the
Yep.
factory and lean in healthcare. It'll probably air by the end of the month. I don't have a date
Okay.
yet, but it'll air sometime in February. And you'll hear it on Morning Edition, which runs from 5 a.m. to 9 a.m. on 102.7 FM or 88.1 FM.
Okay.
And you can also go to our website, which is ripr.org, and we have all of our stories archived there. So if you miss it for any reason, you can find it there. If it's not on the front page, it'll be on the front page that day. Afterwards, it'll be under the healthcare tab, so you can see all the stories I've done.
And then we'll post it to the Lean Nation.
Sure.
We'll do a blast out because I think it's really good that you're starting to see this, and you'll probably get a lot of people chiming in on your blog. And the one thing that I want to leave you with, we had our Blue Cross Blue Shield provider, actually from Blue Cross Blue Shield, here yesterday, and kind of gave her the connections of this full circle and just some of the things that I know what's happening in healthcare. And you might be my good advisor to give me the inside scoop. But she said that they had sent out an email that day looking for an advisory board. You know, they wanted to put together an advisory board. So she asked if I wouldn't mind being on it. And I said, yeah, because number one, you know, we're kind of in a unique spot. We consume the product, right, for everybody here in our organization. So I'm a payer for a lot of people.
Right.
I'm a personal consumer myself. And then we have the lean piece to it as well. And then we have the global look besides just Rhode Island with Lean Nation about what's going on around the globe. So hopefully they get me on that advisory board, because otherwise they're going to have people that aren't out in the field. And I think that's the biggest issue, is that people aren't out doing the walk and getting firsthand knowledge of what does it look like out there. They're going into a boardroom and they're listening to a presentation and they don't have complete grasp of it, or are even afraid to ask questions because they don't want to look stupid.
Luckily, that's my job as a reporter, to ask lots of questions.
Lots of questions. So, that's it for the Lean Nation today. We're over and out, and we'll post everything up on Ustream and iTunes as well. We'll see you next week.